Started. So hi all and welcome to the September CLaN seminar. My name is Dr. Alex Stevenson. I'm the Director of Research at Northern New South Wales Local Health District. Today I'm thrilled to be joined by Dr. Roshan Rigby, Assistant Professor in Nutrition and Dietetics at Bond University, and also Kate Odgers-Jewell, the Allied Health Research Conjoint Academic between Bond University and Northern New South Wales Local Health District. Together, Kate and Roshan will guide us through a presentation on asking the right question, developing qualitative interview and focus group guides. To officially get it started, we acknowledge the traditional custodians of the lands and waters where we work and live. We acknowledge the traditional custodians living culture, their connection to country and their contribution to the life of the various regions where we're joining from. We pay our respects to the ancestors and elders of these regions and to all Aboriginal people past, present and future, and any Aboriginal people that may be joining us today. So welcome everybody. Just a little bit about the Rural Research Collaborative Learning Network. If you're not familiar with this network, we're quite a large consolidated network now spanning most of New South Wales and formerly also in Queensland. We consist of 10 local health districts in New South Wales, the Health Education and Training Institute and New South Wales Ambulance, but we distribute our comms widely throughout New South Wales. We also capture a number of organisations in Queensland, including a number of hospital and health services. What we've found is our comms are spreading organically into other sectors, jurisdictions, and even internationally. So wherever you're joining from, welcome. If you've missed any of the CLaN sessions or want to catch up on any of the previous sessions, we record all of them and upload them to the CLaN YouTube channel. You can just access the CLaN YouTube channel using the link on this page. Just a little bit of housekeeping. We are expecting a fairly large attendance today, as we have done for all sessions this year. So we encourage everyone to keep your microphones muted, or else I'll have to trawl through the attendance list and mute you myself. We're also recording the session. If you don't want to appear in the recording, just simply turn off your cameras. That being said, we encourage you to ask questions throughout the seminar. Please do so using the chat function, and we'll endeavour to answer them if we get to them. If we have time at the end of the session, we'll open the floor up for live questions and also follow up on any questions we couldn't answer that came through the chat. Now, without further ado, it's my great pleasure to introduce you to our presenters. We've got Dr. Roshan Rigby, who is an accredited practicing dietitian and assistant professor of nutrition and dietetics at Bond University. Roshan completed a PhD in 2021, where she researched the application of behaviour change theories and techniques in dietetic practice at individual, practitioner, and also university levels. Roshan's research interests include health behaviour change, dietetics education, health promotion, and qualitative research. Dr Kate Odgers-Jewell is the Allied Health Research Conjoint between Bond University and Northern New South Wales Local Health District. Kate is an accredited practicing dietitian, educator, and researcher. Kate is a mixed methods researcher and really loves the opportunity to learn more about people's experiences through qualitative research. So I'm going to stop sharing and welcome Kate and Roshan to take over. Thanks, Kate or Roshan. I'm not sure who's going first, but over to you.
Thanks so much for the introduction, and thanks for inviting us to present today, Alex and Zoe. We really appreciate it, and we know what a big impact CLaN is having, not just in New South Wales, but now across several states in Australia, and how positively people speak about the sessions. So, yeah, very excited to be here today.
Thanks.
And always, yeah, always excited to talk about qualitative research. So today we're going to cover three kind of key things. The first is around designing qualitative studies and how we collect data. The second is around how we develop focus group or interview guides and make sure we're asking the right questions by using inquiry logic. And then the third is the importance of piloting those interview and focus group guides. But before we get started, we'd really like to get to know a little bit more about you. So Zoe's going to share some polls. So the first thing we'd love to know is, are you a clinician, a researcher, a clinician researcher, or something else? So we'll give you a few seconds to respond there. And then our second question, which should come up for you, is, have you conducted qualitative research before? And your options are yes, no, I'm planning to, or I'm qual curious. So once you've responded, we should be able to see the results. Alrighty, so there are lots of clinicians and clinician researchers and other. Maybe we need to add more categories next time. And 48% of people have conducted qualitative research before, 30% are planning to, so that's really exciting. Hopefully this is well timed and very helpful for you. Thank you for the responses.
Thanks, Kate. So I'll just briefly talk about what is qualitative research. I know this might not be new information, but just revisiting some of these key concepts is just a nice refresher. So qualitative research utilizes non-numeric data to attempt to uncover the deeper meaning behind human experiences and behaviors. So data can be in the form of observations, texts, pictures, but not numbers. So it also helps to answer research questions that explore how and why individuals act in certain ways, and also the reasons behind various aspects of behaviour. Qual research allows researchers to explore, narrate, and explain phenomena to make sense of complex realities, and as I said, examines the how and the why of decision making rather than the when, what, and where. So two common methods for conducting qualitative research are interviews and focus groups, which will be what Kate and I focus on today.
Thanks, Roshan. So again, just a quick recap in case you're trying to remember what the differences are between qualitative and quantitative research. Qualitative research enables us to describe the meaning, experience, and perceptions of our sample. Usually we have fairly small sample sizes, but they are focused and well selected. The data that we get is interpretive, and it's in the form of those words, observations, or reflections. And when we analyse the data, we look for patterns and meaning. We report rich narrative data, as Roshan said, not numbers. And the researcher really is part of the process, not just as the interviewer or the facilitator of the focus groups, but they're immersed in that data analysis, and their lived experience and biases and assumptions will all come out through that process. And it uses communication and observation. Where quantitative research focuses more on reduction, control, and prediction, we generally want really large samples that are representative of a population. It's measurable. We have numbers. We use statistical analysis. It establishes relationships or causation. The research is separate to that analysis process, and we utilise instruments like validated tools to actually measure outcomes, or we might use other things like blood pressure measures, blood tests, biochemistry, that sort of thing. I love both, so I don't judge, but a lot of quantitative researchers don't love qualitative research. So we encourage you to be qual curious and to consider the many strengths that qualitative research can bring. So it really helps us to gain insider perspectives into issues that are complex and subtle. It helps us to understand relationships, causes, effects, and the dynamics around issues, and can provide really rich data. There's definitely limitations of both quantitative and qualitative research. And some of the limitations of qualitative research is that the analysis can be lengthy and can take a lot of time. It is subjective, so it's open to misinterpretation. And it's difficult to replicate because of that really central role that the researcher plays and the context plays.
Thanks, Kate. So the methods quite commonly used in qualitative research are interviews or focus groups. So I'll just briefly touch on each of these methods and what the advantages and disadvantages are to consider, if you're planning to do any qualitative research, making sure that the methods that you select really align with your research question and flows well. So for interviews, the main objective of that is to obtain individual perceptions, beliefs, feelings, and experiences. And doing one-on-one interviews helps to gain in-depth information, identify personal experiences, but it's also useful for sensitive issues as well, where, private conversations and sensitive topics might not be appropriate for a focus group. And can also help identify context as well. So with interviews, researchers encourage participants to talk about issues that are important to the research question by asking open-ended questions and typically one-on-one interviews. So as an interviewer, you're really immersed in the research process. So the interviewer might reword, reorder, or clarify any questions to further investigate topics that are introduced by the respondents. And in qualitative health research, in-depth interviews are often used to study the experiences and meanings of disease and to explore personal and sensitive themes. However, some disadvantages of doing interviews is that there isn't that interaction or feedback from others in a group setting. Individual perceptions only, so you might need multiple interviews to identify a range of different issues. Now with focus groups, so objectives of a focus group is to obtain a range of opinions on a specific issue. It's useful for community norms or even evaluations as well. So advantages are that group interaction can help provide a range of issues or opinions. Discussions can provide detail, justification and clarification, and you can collect a lot more information quickly. However, you don't want to just do a focus group because you want to be collecting a lot more information. You, of course, want to make sure that it really aligns with your research question and the purpose of what you're doing. But of course, there are some disadvantages that come with focus groups. So depth of information can be limited because you may not have the time to really probe further as you would with a one-on-one interview. And of course, less suitable for some more personal experiences. And of course, as the interviewer, you need to be able to manage group dynamics, and that can be challenging as well. So you need to facilitate that conversation. So focus groups are semi-structured discussions with groups of 4 to 12 people that aim to explore a specific set of issues. Moderators often commence the focus groups by asking broad questions about the topic of interest, and then before asking the more focal questions. So although participants individually answer the facilitator's questions, they are encouraged to talk and interact with each other. And the technique is built on the notion that the group interaction encourages respondents to explore and clarify individual and shared perspectives. So focus groups are used to explore views on health issues, programs, interventions, and research. So another poll and activities. So when reading these research questions, I want you to decide which method would be most suitable to address each of the research questions. So the first is, how would individuals with type 2 diabetes experience the challenges of adhering to a recommended dietary regimen? Would individual interviews, focus groups, or either could work for that? And then when you click the next one, brings up your second question. So what cultural beliefs and practices influence food choices during pregnancy in rural Indigenous Australian communities? And the third is, what factors influence the retention of allied health professionals in rural settings in New South Wales, Australia? And wonderful. We seem to have quite a few responses already and some more coming in. So for research question number 1, how would individuals with diabetes experience challenges? Individual interviews most likely, but a lot over half say, just over half, 51%, say either could work. So depending on whether there is a specific or a common experience that the people with type 2 diabetes have experienced, and then they can probe and talk about that amongst themselves. So for research question 2, a bit of mixed responses here. Some say, and of course, depending on the type of questions you're wanting to ask and the sensitivity of topics as well, will really depend on which type of method that you choose. So for the cultural beliefs and practices, there's almost an even split between those. And the final one, so what factors influence retention of allied health professionals? Most say either could work, or even focus groups if they're wanting to get perspectives from a range of different health professionals.
I suppose it's also important to understand how those groups get along with each other. So, for example, if you were talking to allied health professionals working in a rural setting, do they get along well? Is there a lot of infighting or issues going on within the team that you think if we put them in a focus group, this might be an issue and they're not going to feel comfortable sharing and speaking openly and honestly? So lots of dynamics and things to also consider.
Okay, so in this next bit, we'll talk about designing qualitative studies. So when developing a qualitative research question, yes, we can focus our question on the PICO format, quite similar to what you would do in quantitative research, but overall the PICO format in relation to qualitative, the P will relate to the population, patient, or the problem. So being really clear on who or what is being studied. The I will then relate to the interest or the issue. So this is the event, the activity or experience, or the process that you want to explore. Next is the context or setting. So this is the setting or the distinct characteristics that are relevant for your research. It might be within primary care settings, it might be hospitals. You can detail there what's the context of the research that you're doing. And for O, this can refer to the specifics of your inquiry. Are you interested in looking at experiences, the views, perceptions, or perspectives? So the PICO format can help just contextualize what you're wanting to ask and formulate your research questions so that the methods you select and the data collection you do aligns with your aim and what you're wanting to ask. So an example research question for a qualitative study could be, this research aims to explore the experiences of individuals with type 2 diabetes who participated in a group education program to guide the development and facilitation of these programs in the future. So the population, sorry, Kate, just back one more, please. Thank you. We can see the population. There are individuals with type 2 diabetes, and their experience or the event is those that have participated in this group education program. And then you're wanting to know their experiences to help guide and facilitate the programs in the future. Thanks, Kate. So when you've stepped through a PICO format and mapped out what your research question is, then the next steps is then developing your study objectives. So your objectives in qual research are often exploratory, that seek to understand that how and why rather than just what. So for example, to explore individuals' motivations and reasons for attending the program. This is if we're developing objectives from that research question I just mentioned earlier. Another objective might be to identify individuals' preferences for group program structure. So whether it's a number of contact hours for facilitators, getting their insights to how the group program went. Another can be to identify the effects of the group environment on the individual's learning and impressions for support. To identify outcomes, so whether it's their confidence or their self-efficacy, lifestyle changes, any dietary changes they may have made. and also to explore individual satisfaction of the program. So these different objectives will then overall answer that research question.
Alrighty, so when you are designing your qualitative study, what we'd really encourage you to do is to consider using a reporting guideline similar to this one, CORIC, the Consolidated Criteria for Reporting Qualitative Studies. This is a 32-item checklist, and they're often used when we're writing up our final report from our research or developing a manuscript as a checklist where we go through and say, have we said this in the methods? Have we provided that in the results? But what we would encourage you to do is to use this in the planning phase and that design phase. So when you're developing your protocol, bringing together your research team, putting together your ethics application or your quality activity application, so that you can really be prepared and think through all of the aspects that are going to help to make your study comprehensive and rigorous. So this checklist has been designed to promote comprehensive and transparent reporting of qualitative research, particularly studies that use interviews or focus groups as a methodology. It helps us to detail all of those aspects around the research team, the methods, the context, the findings, the analysis, and also the interpretations of the data. And it aims to improve rigor, comprehensiveness, and credibility of qualitative studies. So this looks very detailed, but I'll step you through it. In domain 1, we start to think about our research team and our reflexivity. So we think about who do we want to be our interviewer or our facilitator of focus groups? What are their credentials, their occupational background, their gender, their experience and training? And what is their relationship with participants? So in the example Roshan provided, that was actually one of my studies, and I facilitated the group education sessions for people with type 2 diabetes. And so it wasn't appropriate for me to then do the interviews or focus groups and ask them questions about what they thought of the facilitator or the program, because they might not feel comfortable saying that to my face if they thought there were areas for improvement or things they didn't like. And so we had someone else come in and do those interviews and focus groups. So in this part, we think about, was there a relationship before the study commenced? Did the participants know the researcher? And what are the interviewer's characteristics? So what bias, assumptions, reasons, and the interest in the research topic are they bringing to that process? We then move to domain 2, which is the study design. And within this, we think about our theoretical framework. We're not going to go into huge amounts of detail on this today because we know there was a great 3-part qualitative series run by CLaN last year. So we will link those for you. But it's considering what methodological orientation we would have to underpin our study. When we think about participant selection, we think, who is the right sample? Who do we want as our participants, and how are we going to approach them? What sample size are we going to aim for? And we're going to keep track of how many people we've invited versus how many said they would like to participate or would not like to participate. With the setting, we need to think about where we will complete the data collection. So is it going to be best to go to people's workplace, to a clinic, to their homes? Could we do it online via Teams or Zoom? Is it best to be in person? Would we have other people in the room? So if we were doing this face-to-face and it's an interview, is it just the 2 of you, or would you invite others to come along? And what are those important characteristics of the sample that we need to be able to describe? So we need to capture that data when we are recruiting and consenting participants. When it comes to data collection, we need to think about what are the questions, prompts, and guides that we are going to use. Are we going to provide them to participants before we commence interviews or focus groups? How are we going to pilot test? Are we going to offer repeat interviews? Are we going to send out the transcripts to participants to review and to add comments or corrections? How are we going to keep our own observational notes? Are we going to keep a reflexive journal, write notes, speak with someone else? Someone's sound is on. And what are we expecting the duration of the interviews or focus groups to be? And how will we measure and keep track of whether we've reached data saturation? Then finally, we move to domain 3, which is around the analysis and findings. So we think before we start, who's going to code the data? How are we going to do that and go through that process? Will we derive themes in advance, or will these emerge from the data? Are we going to use software? Will we use Excel, Word, Post-it notes? And are we offering participants the opportunity to provide feedback on the findings? Then finally, with the reporting, are we going to use participant quotes, exemplar quotes, to illustrate the themes and findings? And how will we identify those? Are we going to number them as participant 1, participant 2? Are we going to number them by discipline, social worker 1, social worker 2? And how will we ensure the data and findings are consistent and clarify which are major themes versus minor or sub-themes? So lots of things to think through. And as I say, that is a helpful thing to look at when you are planning and developing your study and working on your protocol.
So some other considerations that, regarding data collection, which Kate had mentioned. So thinking about the methods of data collection, is it face-to-face, telephone, video conference? Are you doing a structured, semi-structured, or asking non-structured questions? Thinking about who you're going to recruit, your inclusion and exclusion criteria, and how will you obtain consent? Will you do it verbally and record it? Are you getting them to write it down on a consent form, and where are you going to keep that form and retain? How will you recruit participants and set up a mutually suitable time and location? So this might take a little bit of time to figure out what's the best method of, I guess, that admin work of booking interview times. How will you share the interview and focus group? Oh, sorry, will you share the interview or focus group guide before and the transcript after? This is, of course, research dependent. So typically you might want to provide the interview questions beforehand so that your participants are aware of what they're going to be asked, especially if they need to touch on experiences from the past, and they may need some time to reflect on it and think about those things that have happened. So having a think about, how you're going to share that, and also the transcripts after. So that aligns with, I'm just getting a little bit of feedback. So that aligns with that core Q questions about whether the participants are going to check the transcripts afterwards as well. And will you use prompts within the interview itself to collect data? Are you going to use photos to help elicit memories, videos, vignettes, or case studies to help facilitate that an interview as well? And having a think about, are you going to record or not record, whether it be audio or video? If it's not going to be recorded, then how is that going to be transcribed? And think about the implications that that might have on your research as well. And triangulation of methods. So having reflective journals, notes and observations. Of course, you should be writing notes and your reflections throughout the whole entire research process, because that can help inform, the questions you ask, how you're analysing the data, the initial thoughts you might have will influence your analysis as well. So some other things to be considering with data collection. And how will you decide if data saturation has been reached? Is data saturation a concept that your research team is wanting to achieve, or is it more theoretical saturation? If there's enough themes coming out from the interviews you've done, or do you need to conduct more interviews? With qualitative research, it is quite iterative. You will conduct some interviews, analyze the data a bit more, go back and do some more interviews. It is a sort of backwards and forwards process, which differs greatly to quantitative research, where you collect your whole sample size, you do your test and you analyze. Qualitative is a bit different. And then thinking about who's going to be involved in that analysis and interpretation, and have you set up a research team that have the right qualifications to be able to support the analysis as well. So choosing your research team is also a very important part of this process. Okay, so some do's and don'ts for qualitative data collection. So do ask clear and open-ended questions. I think having a health professional background, the process of asking open-ended questions, so trying to elicit as much information from our participants, or whether it be our patients. I think we all know how to ask those open-ended questions. And of course, pilot your interview or your focus group guide before you do your interviews. It's always great to be familiar with the process of the interview guide and be comfortable with asking the questions, and we'll touch on piloting at the end of this presentation. So do align your questions to your objectives. So I would always recommend, and I recommend this to my students when I'm teaching them, on your interview guide, clearly have your research question at the top. What are your objectives? They're clearly listed. And when you develop your interview guide and your questions, do they align and do all of your objectives align with your questions? So you make sure that everything is tracked off. It's important to ensure that you leave enough time for yourself before and after the interview to take notes, to make sure you set up on time, especially if you're conducting your interviews online over Teams, for example. This is becoming much more popular post-COVID era, is doing more telehealth and online interviews. Have you set up the space, and are you familiar with the functionalities of Teams or Zoom, whatever software that you're using, just to allow that interview process to be more seamless for your participants as well. And if online, set up your camera so that you are talking to your participants and not facing away. And with focus groups, it's good to set some clear group rules at the beginning, and remembering that you are the facilitator of the focus group and you're wanting the group to be talking amongst themselves, but you can set some really clear ground rules at the beginning of, some expectations. And then thinking about some things of what not to do. Asking closed questions. Of course, this is, you can be asking closed questions, but first ask the open-ended ones as well. Your prompts or your probes might be more closed questions. Don't wait to the day of your interview to familiarize yourself with your guide and to, refresh yourself with what you're wanting to ask. Pilot the interview guide and be familiar with the questions that you're asking. Don't have too many questions. Of course, this can be a bit arbitrary, but it depends on your research question and the aim of your research as well. But having too many questions and your interview becoming far too long, then the participant and yourself, you'll become fatigued and you might not get the richness of the data that you need. Also, don't put words into people's mouths at all. So by asking leading questions or, off the bat, it's good to be more open and allow them to come up with their own thoughts. Don't be afraid of silence as well. So when you're asked a question, sometimes you do need a bit of time to sit and think and reflect on the question. So be okay and comfortable with a bit of silence after you have asked, a participant a question, to allow them to think and process what is being asked. So don't be afraid of a bit of silence. It's okay. Also, don't judge. We want our participants to be as open and honest as they can with their questions. So we definitely don't want to come across as judgmental and have that coming across. Also, don't interrupt to tell your own story. Yes, we have a vested interest in our participants and in the research topics. However, we're still wanting to maintain, a level of separation from the participants and their experiences and not influencing them by our own experiences or opinions. Also, don't be afraid to redirect the conversations, especially if there's a time constraints or if the topic is going a little bit too far out of the scope of the project or your interview guide, don't be afraid to redirect and prompt them to come back on task. And within a focus group, don't let one person just dominate the entire group discussions. You want to allow everyone to have enough time to answer questions, and that sort of leads into don't be afraid to redirect. You might need to then ask each person to provide a response themselves. So just some do's and don'ts, but I'm, of course, for those that have had experience in qualitative research, I'm sure you have some more to add to this as well, which we would be keen to hear about too.
Thanks, Roshan. So we have one final activity for you. Hopefully everyone's still excited to answer a poll. And what we're going to ask is for you to read each of these questions. So there's 4 questions that will come up, and decide whether they are open or closed-ended, or yes, or whether you're not sure. So the first one is, what does healthy eating for your diabetes mean for you? The second is, do you follow the Australian Guide for Healthy Eating? The third is, describe the factors that support you to eat well at home. And the final one is, how many meals do you consume a day? So we don't need to know how many meals, we just want to know if it's open or closed. Fantastic. So the first question, almost everyone has said that's open-ended. Absolutely. The second question is closed. Yes. That could elicit a yes or no response, which is not going to give us a lot of information if we want to know what people are actually eating. The third is open-ended. So yes, we would hope that people are not going to answer yes or no to this. They are going to describe what are the things at home that help them to eat well, to cook. Does their wife help out in the kitchen? Are they really into trying new recipes? And then our last one, how many meals do you consume a day? So this one's a bit trickier, but chances are you would just get a one-off number response. So people might say, I have 3 meals a day or 2 meals a day, and it's not going to give us a really lot of information or depth as such. So thank you so much for responding to those. Great to see the same numbers responding after this many minutes. As I mentioned before, last year our CLaN did a 3-part qualitative series. I think Zoe's linked them in the chat, but there were 2 sessions that would be really valuable for you if you are planning to do some qualitative research. The first is around choosing the right lens, and the second is around qualitative data analysis. So these are all available on YouTube, and as I say, very valuable sessions. We're now going to move into asking the right questions. So how do we develop our interview or focus group guides? So typically interview or focus groups are semi-structured. So it means we're not reading off in a really structured way, question by question. This is question 1, this is question 2, give me your answer, then I'll go to question 3. We develop them so that we can have some flexibility and make the interview or focus group a little bit more conversational, relaxed, and comfortable for participants. We really encourage you to focus on the research question and the research objectives in formulating the questions. And one of the reasons I say that is I think often people get excited and they think, oh, this is a great opportunity for me to find out the answer to this question that's interesting to me, but actually is not related to the research or the objectives and is a bit left field and random. And we really need to make sure we've got that alignment. Using our open-ended questions and probes, obviously when you're collecting demographic data and consenting participants, those questions don't need to be open-ended. But when we are asking our actual questions in the interview or focus group, we want to elicit responses that give us some depth and detail and narrative. We want to use language that's relevant and easy to understand. So that's not a lot of acronyms, not a lot of medical jargon and terms. We want to not have really long-winded 2-3-part questions. I'm sure everyone's experienced job interviews where you get to the end of the question and think, what were you actually asking me? There are about 4 things in there. Very confusing. And also consider that focus group guides can be shorter than interview guides because you've got that group interaction, that dynamic that's occurring. You're encouraging the participants to talk to each other, to have discussion. Whereas when you're interviewing a person one-on-one, you might have opportunities to ask more questions in that conversational way. So your questions can adapt. You don't need to, in a semi-structured guide, you don't need to read them word for word. And you can flex. So if your participant starts talking about a topic that you are going to ask a question about later, that's your opportunity to ask the question and to continue the interview in that conversational, comfortable style. So this comes back to the example research question and objectives that Roshan shared earlier. And as I say, this was a study I did during my PhD. And we use this inquiry logic where we outline what our objective is, and then we develop our question and our example prompts from that objective. So you can see the examples there. So our objective of to explore individuals' motivation and reasons for attending the group education program. We ask things like, why did you get involved in the program? What is it about the program that attracted you to get involved? For something like identifying the effect of the group environment on the individual's learning and their impression of support, we ask things like, please describe how the other people in the group helped or hindered your learning. How do you feel the group has contributed to the changes that you've made? And what was the role of the group facilitator in the discussions within the group? And then we had prompts like, did it help you at all to know others in the group were in the same situation as you? Or how did the group facilitator educate the group? So hopefully you can see there's some alignment there between the objectives. We didn't just ask random fun questions. And here's some more examples. So looking at identifying outcomes. So how's your knowledge of type 2 diabetes changed since you started the program? How has your diet or exercise changed? Have you changed your blood glucose testing? How have your health and attitudes changed? And exploring individuals' satisfaction, we ask things like, would you recommend this program to your friends? And if so, why or why not?
Thanks, Kate. So now I'll just touch on piloting your interview or your focus group guide. So piloting can enable yourself as a researcher to get more comfortable with those questions and the probes, and can also assist in making sure that the questions are clear and easily understood. Piloting can also help you estimate the length of the interviews or the focus group, so it can give you a bit of a rough guide on to setting clear expectations to let your participants know, hey, this interview is going to take approximately 45 minutes, and then you can schedule that accordingly into your calendar. And usually piloting of the guide should be completed 1 to 3 times. After this, you can then refine and finalize the guide and commence your data collection. And also just to note that you can decide when you're wanting to do your pilot or when you're designing your study, are you going to include that pilot interview as part of your data? Because it could potentially be valuable data and you might not need to change your interview guide. So you can think strategically about if who your participants are, if one of those likely participant groups will be involved in piloting of your interview guide, and whether that will then be used as your data. They could be participant number 1. But always good to practice reading your script, being comfortable with, asking probes and prompting as well.
I did notice, sorry, there was a question in the chat around whether you should pilot before or after submitting your ethics. And I would just flag, it's probably useful to have a chat to your research office or your ethics committee about that, because some ethics committees like you to explain how you're going to pilot once you have your ethical approval, and others are happy for you to pilot before you have your ethical approval. And I suppose that also depends if you're planning to include or exclude that person that is part of the pilot, their data in the study or not. So just clarify that.
And so Kate and I have provided some resources here, which have been shared within the chat anyway, so that's been really great. So the core Q, that's that 32 item checklist. Of course, it is a reporting guideline, but don't think about just using this towards the end when you're writing up your manuscript. It's so valuable in actually designing your research and setting up your protocol to make sure that, you know, all those checks are met. There's also the Agency for Clinical Innovation, so the ACI Participant Experience Focus Groups. That link there is a facilitation guide, so it actually steps you through how to set up your focus group, things to consider, so that's also a very valuable guide as well. And then a paper on 12 tips for conducting qualitative interviews, maybe a bit of a refresher on what Kate and I have discussed today, but also, yeah, good to read other perspectives as well.
Fantastic. Thank you, Roshan. The ACI guide on facilitating focus groups is really useful. It really gives you those practical tips around how would you set up the room, how are you going to manage those group dynamics and prompt people. And the tips for conducting the qualitative interviews are really beneficial as well. I see, sorry, I'm going to get distracted by the questions before we get to question time. But Zoe has asked, who should you pilot your questions with? Would that be with colleagues, people who are or aren't eligible to participate? And in my mind, that really depends on what you would like to do. For me, I generally pilot with colleagues, people that I'm really comfortable with, because oftentimes you will revise or edit your questions based on that feedback. So it enables you to say, what did you think of those questions? Did they make sense? Were they clear? Was there anything that was confusing? And it helps me to feel more confident and comfortable before I actually start the interviews or focus groups. But a lot of people pilot with participants and include that data in the data collection. Yeah.
So as a summary to wrap us up for our webinar today, is that use reporting guidelines at the design phase of your research. So whether it is core Q or there's another qualitative research one as well. If you go to the Equator Network, there's a whole range of different reporting guidelines you can find. The second is take the time to plan your data collection, especially all the different steps involved and the considerations that you need to make. Third is to develop focus group or your interview guides that clearly align to your research question and your objectives. As Kate was mentioning, yes, you might want to add in some interesting things that you want to ask of your participants, but if that's not aligned to your questions and your objectives, then it's probably not appropriate to be asking in your interview. And of course, pilot your interview and your focus group guide. So we'll open up the floor to questions. Thanks, everyone.
There are a couple that I've noticed that I'd love to chat about. The one is around using published literature, so other qualitative studies, to help develop your interview or focus group guides, and I would definitely encourage that. So if you've found a qualitative study that has similar objectives or research questions to yours, often they will publish in the supplemental files or the appendix their interview or focus group guide. Alternatively, feel comfortable contacting researchers and asking if they would be willing to share that with you. The other benefit is having a look at the limitations. Is they might say, we really could have explored more things within the interviews or focus groups, and that can help you with designing your study. Are there other questions that you've seen in the chat, Roshan, that you want to? Oh, there's something about data analysis.
There are a few questions actually in there, Kate and Roshan, and thank you very much for the very informative presentation. So there's one early on from David Smith. He asks, what makes something a focus group and not a group interview?
I was going to ignore that because it was too difficult for me, David. I actually don't know. I've never seen anyone use group interviews before.
Maybe take that one on notice.
we can chat about it another time, Kate. Thank you.
Thanks.
Sorry,
David.
I wasn't trying to put you on the spot.
There's a question from Richard. Thoughts on the efficacy of member checking sending transcript back to participants? There's a lot of discrepancy in the literature as to whether this is beneficial to achieving research aims and the well-being of participants. Any thoughts there, Kate, Roshan?
In my experience, I've sent the transcripts back to the participants just as an opportunity for them to provide any feedback and, have I captured the data accurately for them, as just a quality check in a way. And if they've not provided any feedback after X amount of weeks, then I let them know in their email that their data is going to be used. But yeah, I guess probably dependent on the type of research you're doing.
Yeah, I agree, Roshan. And I think particularly if you aren't sharing your interview or focus group guide beforehand, often participants might at the end leave and think, oh, I forgot to say this, or I wish I'd added that. And if you give them a couple of weeks and the transcript to add in notes or edit things that we might have misunderstood or misinterpret, it's a great opportunity. I think often you don't get a huge number of responses. People are quite happy with what they've provided, but it just gives you an opportunity to, give them that chance.
Good point. Yeah, thanks, Kate Roshan. There's another question there. This one's from Zoe. Is there an ideal length of time for a qualitative interview or focus group?
It's a very good question.
Kate, you've been involved in more focus groups than myself.
It really depends, on your focus group guide, how many people you have as part of that focus group. I would always give a range. And what you don't want to do is say to people, come together and we're going to talk for 3 hours. Like, that's exhausting for everyone.
Gosh, yeah.
Unless there's food involved.
Yeah, unless there's snacks. Absolutely. That's very important.
I say for an interview, 45 minutes to an hour can allow for, those in-depth discussions to be had. And I think depending on the amount of questions that you're asking as well. And I think collectively how many participants you're having and how many hours worth of interview that might be in total, it could be something to consider as well. But always looking back to what's been published before in the area that I'm, interested in, what have previous authors done in their studies.
Yeah, good. Excellent. Thanks.
And the piloting can help with that. You might do a pilot and think that only went for 20 minutes. Maybe I don't have enough questions, or maybe I haven't asked enough prompts. Yeah.
Thanks. There's another question. I think you might have answered this. This is, do you base your questions on the literature or other studies to justify? That's that one.
Absolutely.
Another question there. Do you map the questions to individual measures in addition to mapping to the objectives, as you just showed?
Not sure what that means. Is that with analysis?
Not sure. This was from Ulla van Haunt. I don't know whether Ulla's there or not.
Hi, it's Eula here.
Eula, okay.
Sorry. Yeah, I just meant normally if I was designing like a quantitative survey, I'd be have another column to say what is this particular question measuring when I'm designing it, to make sure that I'm measuring all the things that I need to, but I'm not measuring, I'm not duplicating or measuring things that are not top of the list kind of thing. So I just saw you had mapped it in the table to the objectives, and I just wondered whether you then broke it down even further.
I suppose it depends what you're trying to understand, and usually we're using qualitative research to understand someone's experiences, so we don't necessarily need to talk about individual measures. It's more what their experience is, what meaning they've made from that experience, etc. I don't know if you want to add anything, Roshan.
Yeah, I guess it's the similar concept that we have the objectives and then the questions to make sure it then links. We've covered all the objectives that we're wanting to address. And also depending on if you're using like a behavior change theory or a model to help inform your questions, if the constructs of that, like say it's theory of planned behavior, have you covered off attitudes and intentions? Are those constructs that you're interested in? Do they align to the questions, and then do they align to your objectives? I think either way, how you develop that table, as long as there's some form of cross-checking that things have been covered. Yeah, that's the way I would do it.
Excellent. We're happy to move on. There's another question from Zoe. It says, who should you pilot your questions with? Colleagues, people who are eligible to participate, or others?
I think we answered that one.
Okay.
There's a couple asking about software.
I saw that.
So I would think the most commonly used software would be in vivo, but it's quite, I don't find it really user friendly, and often health services don't have access to it. I'm very happy with Excel and Word and Post-it notes, in all honesty. I don't know if you use software, Roshan.
Yeah, I use NVivo. I think it's helpful to categorize and make your codes, but of course we don't have software to analyze our data for us. It cannot do that. We're the ones going in and analyzing and creating the themes and seeing what is coming from the data. So I'm like NVivo because it's just can be a bit more structured and helps with the codes. But I've used Excel as well, which has worked really well because you can have the different filter functionalities and your different sheets down the bottom. So it depends what you're comfortable with, really.
Excellent. And we might just do one more question, then I'll wrap up. And this is the very last question that's come through for me. This is from Anne-Marie Winters. Do you need to use the exact same questions for each focus group if you plan on doing multiple for the same research? So you can compare or can adjust the questions as you do more focus groups?
I think if your guide is semi-structured, then your wording is never going to be exactly the same, but the objective and the concept of the question should remain. So I don't think you should add in completely new questions or concepts, but as you become more familiar with that guide and do more and more focus groups, you might ask those questions in slightly different ways.
All good. I know there's more questions in the chat. I'm sorry to people that we didn't get to them. I want to thank Roshan and Kate again for a fantastic presentation today. For those of you that are able to join us, we're going to hold our next seminar in October, and this will be by Dr. Victor Zask on survey, schmervey, the ins and outs and roundabouts of survey design. I did put in the chat a link to our short evaluation survey. If you can get to that, just please let us know how we're doing. It's important for us to track how we're going. Otherwise, I'll leave it there. I'll thank Roshan and Kate again for the fantastic presentation. Thank you, everyone, for joining. I wish you a happy Wednesday afternoon, and hopefully see you next month. Thanks, everybody.
Thanks, everyone.